We have Elliot Cushing here from Aetna Student Health Insurance, and he's going to provide an overview of the GA health insurance plan and a walkthrough of the portal. So Elliot, I will pass it off to you.
Sure. Good afternoon, everyone. I will share my desktop when we move over to the aetnastudenthealth.com website and portal to demonstrate some of the functionality of it. But for now, again, Bailey is your contact at Boise State for any questions. In general, real couple quick things. The GA plan for the Boise State graduate assistants, it's a pretty rich plan in the fact of what the coverage is. A couple quick things for some of you that are familiar with the American healthcare system. We have a deductible, that means that is the amount of money that you pay out of your pocket before claims begin to be paid. And so for the students, it's $1,250 per plan year. And your plan year starts on August 1st and runs until the following July. It doesn't run on the calendar year. And then the maximum out-of-pocket that you will pay is what we call the out-of-pocket maximum, and that's $4,500. And for most of your benefits that you will go to, anything that is preventive care, routine physical checkups, things like that, anything that is considered preventive, that is covered at 100% with no deductible. So it's no cost to you when you do visit a physician. And for anything that is non-preventive, as long as you see an Aetna physician, the coverage is 80%. However, you will be subject to the deductible first. So say you go to a provider for services and they charge you $2,000, 80% of that, excuse me, so the 80% of that $2,000 would be $1,600. And you would be responsible for the first $1,250, but then your deductible would be satisfied. So they would cover everything beyond that. So a little confusing, and we can go into it if you have questions, but that's basically the crux of the plan. If you're going somewhere for preventive services, it's 100% coverage, no cost to you. If you're having anything done that is non-preventive, then you can expect 80% coverage from the GA plan. And again, if you have questions, feel free to ask. We'll walk through the website and I can show you the functionality of that. So I am going to attempt to share my desktop. I'm going to give it a shot here. I think I click on this. And does everybody see a screen in front of them that says, "Welcome to Aetna Student Health"?
No, Elliot, did you click the share, the green
I did
button?
not. Okay, there we go.
Here
Let's try that. Now does everybody see a screen that says "Welcome to Aetna Student Health"?
Yes.
Excellent. Okay. All right. So if you do have questions about your plan, or you're curious about something, or you want an ID card, or probably most importantly, you're looking for a doctor, you will want to come to this screen here. And the email address is pretty easy. It's just aetnastudenthealth, all one word, .com. We'll bring you to this general page. And then in here, you'll go through, click the drop-down menu, and you will pick Boise State University, and make sure, you'll notice there's two of them. Make sure you pick the GA plan, because that is the one that's going to be applicable to you. So you will click that and click View Your School. And on the next page, all things Boise State University GA come up. And you're really going to be interested in these four buttons right here. Probably the first three. The fourth one, if you're a grad fellow and not a grad assistant, that would be applicable to you. I don't know if we have any on the phone today. If we do, we can walk through what that button does for you. So I'm going to start with the really easy one first. Everybody, you'll probably want an ID card. You do have the option of getting a plastic one, but we do go online for these. So on the website, you would click Get Your ID Card. We make it as simple as easy as possible. All you need to do is put in your student ID and your date of birth and click Submit, and your ID card will fill in below this. You can do this on a laptop. You can do this on an old computer tower if you're old school, Or you can do this on the Aetna Student Health secure member website, or there's an Aetna Student Health app that you can put on your mobile device. In all of those locations, getting your ID card is pretty much the same process. You just need to know your Boise State ID and your date of birth, and you'll be able to obtain your ID card. If you do it from a laptop or you do it from your mobile phone, not on the app, but just use Safari on if you have an Apple iPhone, you can just bring up your ID card and just snap it and take a picture and save it to your picture roll. Most of the time, providers understand that plastic cards are becoming a thing of the past here in the States. And so most of them will just ask you to email a copy of that card or just send it to them and they take a picture of it with their phone. It's quite humorous when I find that when that happens. So that's how to get your ID card if you need it. Super easy. If you are interested in some of your plan details, you have a question about, you want to know how much, what the percentage of something is, you would click on your, on the, I believe it's called View Your Insurance Plan Details. We've changed the name of this a couple times, so I do apologize. This year it's View Your Insurance Plan Details. So in here, we have a bunch of resources for you. You can get your ID card again. If you're a grad fellow, you can enroll. Your member website, a lot of you will want to use this. This is a secure member website. You can register to log in. You just click on this. We'll ask you for some information about yourself, your ID, your date of birth, and the zip code. That's how they set things up. It's based on the zip code that is on file with the school and on file with Aetna Student Health. Once you are in here into this website, you can pull up your ID card. You can look at any claims you want. You can find a doctor. Anything you can do on this web page, you can do via the Member Secure website. So it's a pretty handy tool to have. And it also mimics, if you download the Aetna mobile app, it mimics that. You can do anything on that app that you can do on the member website or on the aetnastudenthealth.com website. So if you are wondering, you're thinking of having a procedure done and you're not sure about the cost of it, and this can be done on the secure website as well and also on the mobile app. But we do have a form in here that you can fill out. You can have your doctor assist you with it and they'll be able to provide you some of the information. And it's just a simple form that is filled out, and bear with me for just a second. It's running a little slow today. There we go. And basically your provider would be able to give you all of the codes that would be used or as part of the procedure. And this can be sent into Aetna and they will send you back an estimated cost. So if you are budget conscious and you just need to know how much something is going to cost you from a medical perspective, this is a great form to use and fill out and submit. And again, it can be done via the secure member website or the app on your mobile. So prescriptions, I'll show you how to find a pharmacy. You can do that in the DocFind tool. This is, say you are traveling out of the country and you fill a prescription outside of the country. This is the actual claim form where you would come in and fill it out and get reimbursement. With most American medical insurances, if you are traveling outside of the borders of the United States, most providers and pharmacies do not accept our insurance. So you do pay out of pocket. You keep that receipt, you bring it back, and you fill out the claim form in here in order to submit to get reimbursed for the pills that you filled while traveling outside of the US. Most of the time, if you're in the US, you go to the pharmacy, you show them your ID card, bam, it's done, it's paid for right there. You don't have anything to worry about this form. But if you are going to be traveling outside the US, that is a good form to have. How to use your plan. This talks about finding a doctor, doing all of that stuff. It also provides you a claim form should you need it. Again, if you're within the US, probably will never have to touch those claim forms. So one of the big resources that we have developed at Student Health that has become a very big hit over the past 2 years is what we call our well-being resources. Say you have a question, you are looking for some resources for physical health or emotional stress, eating disorders, social connectedness. we have what we call the well-being wheel. And there are several links in here, let's say stress, that you can go through. There's several pieces of reading material in here, managing stress, and then where to go for help. We provide you certain places that you can call for assistance, for telemedicine, nurse line, informed nurse line, council for mental well-being, and things like that. And each one of the wedges of the well-being wheel is very similar. Financial health. There's several things in here about understanding, your credit report, financing college, and things like that. LGBTQ resources. There's the Trevor Project podcast, different sorts of documents and resources in here if you have questions about that. So this page, what we call the well-being resources, has become very, very, very useful and helpful. And we have a lot of visitors to this website. And Bailey, also, if you have GAs or other students at Boise State that are interested, they can still go to this website and utilize these resources as well. It doesn't just have to be anybody enrolled on the plan. So, okay. So on the portal, as you can see, you can do several things. There's some helpful videos in here. There's some in here about understanding insurances, finding care. They kind of go through and explain what a deductible is much better than I ever could. So I encourage you all to watch the video because it does a much better job of explaining these things than I did. Understanding, your coverage and your payments and things like that. So these are fun little videos to watch. I actually, the video that I helped, is not up here. I think it's outdated. That's why I actually helped make one. So if you are interested in telemedicine, we have come a very long way for telemedicine. There is a link with several different telemedicine vendors that are all contracted with Aetna. If you use one of these vendors for telemedicine, for behavioral health or just regular medical, these are all contracted with Aetna, so you would get what we call the in-network benefits. So this is a great, MD Live has become a very big one. MindCheck, Teladoc was one of the original ones. There's Talkspace, Two Chairs, Vita. These are all available for telemedicine procedure, services and things like that. And again, they are contracted with Aetna, so you get the in-network benefit levels. And all of the providers that are in there are experienced telehealth providers. They are vetted out. They go through a process to make sure that they meet the criteria and the credentialing and everything else. So these are all, legitimate 100% telehealth providers that you can seek services from. So, all right. At the bottom of this page, you will see this year's and last year's plan documents and benefits. If you are interested in learning, looking at what the plan design is, it's the second document down. It's called the Plan Design and Benefits Summary. For some of you that may have been around in the US for a few years longer, you're maybe in your mid-20s, you may have heard this document referred to before with other insurance carriers or with Aetna as a brochure. So they've just, gotten fancy and changed the name. So, but this is it. And this walks you through, it tells you what your annual cost is and what the monthly cost is. It talks a little bit about the deductible again and what it is, and gives you a full description of benefits. So if you are wondering, what is it for an office visit, or say you want to go hospital emergency room, you go to a hospital emergency room, it's $100 co-payment that comes out of your pocket, and then it is covered at 80% of what we call negotiated rate beyond that. So if your hospital bill is $10,000, you pay $100 out of pocket, the $9,900 is then covered at the 80%, and you have a 20% responsibility. Okay, so the emergency room. Yeah, let's talk about that for a second. You'll notice on this page here, and this is set up specifically for this, you have hospital emergency room at $100 and then urgent care at 80%. One of the things we like to stress, especially for the grad assistants and the international students that come to the US. Going to the emergency room is a very expensive endeavor here in the United States with our medicine. So we encourage, if it's something you're not feeling well, you're not sure, but it is not life-threatening, we highly encourage the use of urgent cares. Urgent cares are much more cost-effective. They can get you in and out. There's usually no overnight stays with them. You go in, you're seen by a licensed physician and treated, and maybe given a prescription for the issue that you're having. Whereas an emergency room, this is a life-threatening event. You've fallen down, you're bleeding, you've been juggling chainsaws and cut your arm off, little things like that. That is when you would use an emergency room. So if you're just not feeling well, but it's not a true emergency, you do not believe it is a life and death situation, we highly encourage the use of urgent cares. It saves you money at the end of the day and keeps more money in your pocket. And it's usually a little bit faster than most emergency rooms in the US as well. Again, this is up to you. If you feel that it is something that requires an emergency room visit, highly encourage you to go with what your body is telling you. If you feel that it is emergency room, then go. We don't want you to sit there and try to figure out, is it life-threatening or not? If you feel that it is, go to the emergency room. But if you're pretty sure it is not, we highly encourage the use of urgent cares. So just a note on that. Because the urgent care, again, they're usually faster and they will save you quite a bit of money. So the big thing on this web page, when you go back, if you're looking for services, is you're going to want to find a doctor that takes Aetna insurance so you get the best benefits possible. So you would click on find a doctor, hospital, or pharmacy, and you would go down option 1. Excuse me, there is a link to find a network provider. So you would click on that, you'll get a new pop-up screen. And so if you are already a member and you've registered with the Member Secure website, you can log in to your secure site and look from there. If you're not and you just want to continue, you're just looking real quick or something like that, you can just do all this right here. You can just do it, continue as a guest. So let's say you're in Boise, Idaho, and just to keep the volume down, we'll go 10 miles. Let's go 5. Most students don't like to travel beyond 5 miles from where they're located. So first thing is you put in your location, and then and this is where what's going to happen for you, student health plans. Your plan is an open choice PPO. So you want the very first button when you're in here choosing your provider. So you want the open choice PPO, and then you will click continue. And then this is where you get in there. You're looking for an urgent care. We have a button for urgent cares, hospitals, medical doctors, walk-in clinics, a pharmacy. So you can find a pharmacy on here. All sorts of various types of categories down here that you can choose from. Or if you know what you're looking for, say you are looking for a chiropractor. You want to go to a chiropractor. You can type in the word chiropractor, click on it here. It'll think for a couple seconds, and then you should get a returned list of licensed chiropractors that are contracted and accept the Aetna Student Health Plan, and it'll tell you how far away from you they are. It'll give you their address, their phone number, and tell you if they're in network. If they're on here, they should be in network. If you ever run across a case that it's not, let Bailey know so she can let me know. So, but then you can go through and just compare, if you live over, maybe you have an apartment off campus and you're over on State Street, this Boise Chiropractic is the closest one to you. You can call them and say, are you accepting new patients? We always recommend that even though they're coming up in this search tool right here, we always recommend calling and just making sure that they are accepting new patients. Some doctors' offices are full and they are not, and they will normally tell you if they do not have the capacity to accept a new patient. So if you're searching for a doctor and you find one, they're in a great location, you've heard good things about them, we highly recommend giving them a call. Their phone number is provided, and just ask them if they're accepting new patients. And they'll ask you for your information, who's your insurance, and you would tell them Aetna Student Health with Boise State. So the lookup tool is actually pretty good. if you don't know exactly what you're looking for, but you are looking for that urgent care because you're not feeling well, you can just click on the urgent care button and it will give you a list of all the local urgent cares. And again, their location. We recommend giving them a call to make sure they're open. I have found in some cases, I live in New England and on the East Coast. To me, an urgent care should be open 24/7. That's the point of it. It's urgent. Yeah, they're not always open. So I would highly suggest that you call them and make sure that they are open before you get into an Uber or drive yourself over to the urgent care. But if you just click on that button, it'll list all of the urgent cares within the parameters that you set, in this case, 5 miles. So as you can see, there are 1, 2, 3, 4, 5, 6, 7 urgent cares within 5 miles of the general Boise, Idaho location that I put in. And when you put in just the city name, if you enter just Boise, it's going to go from downtown, from the center of the city. That's kind of the demarcation. If you want to put in the zip code of the school and then to go 5 miles from that, it'll shift the search results accordingly. So that's how you use our doc find tool. We try to keep it as easy as possible. The one thing you want to remember is you want the very first choice, the PPO plan, when you are choosing the your insurance coverage, because that will depend on which doctors come up in the search tool. So. Now I realize I've just inundated you with a ton of information. There is a lot there. So I am just going to stop talking about the website unless Bailey, did you have anything else you wanted me to go over as far as the portal goes? Or do we
No,
want to open it up for some questions?
yeah, open it up for some questions would be good, but I actually have a clarifying question.
Certainly.
Is it the first choice PPO or the open choice PPO?
Let me go back in there. Uh, doo, doo, doo. It is the open choice PPO, the first one.
Okay, just
Yep.
wanted to make sure. Thank you.
Mhm. Yep.
And does anybody on the call have any questions for Elliot or me?
And if you have a question and you don't want to voice it like this, Bailey has my email address. She can certainly share it with you, Bailey. If anybody reaches out, they don't want to talk online like this, I get it. They just have them reach out to me directly and I'll respond to them. So I'm willing, I'm perfectly fine with doing it that way as well. If you'd rather not say anything over the phone, I get it. But Bailey does have my contact information if you have a specific question that you'd rather not everybody hear about.
Yes, thank you.
Mhm.
There's a question in the chat. Do we have a dental plan? Um,
Yes. Yes,
yeah.
you do. For the GAs, there is the dental plan. It is for preventive only. So basically, it covers your 2 routine checkups and your x-rays.
Is it more of a benefit and not necessarily insurance?
It is insurance.
Okay,
So if you go to a doctor and you have a routine checkup, they will bill us and it will get billed as an insurance claim. Yes.
okay,
It does include cleanings, yes.
great. And then another question, is vision
Mhm.
included?
Bailey, I will pop that one back over to you because as we talked about a few minutes ago when you and I were on the phone,
Mhm.
guys do have vision, but it's not with us, correct?
We do not have vision,
You do not,
actually.
okay.
We have not had vision included with the GA plan for a couple years. You can purchase vision separately, but you would be responsible for those costs. Another question.
Mhm.
I think Molly, we answered yours. The dental benefit does include cleanings.
Yes,
I believe that's 2 per year. And another question, could you please elaborate on health insurance ID? Is there
sure.
any specific ID related to health insurance, or we can use the student ID at pharmacy?
That's a great question. So for the health insurance ID, you have your Boise State ID, your student ID, which you can use. And also there is what we call the Aetna number, and it will always begin with W. So if you have your ID card, you have your mobile phone with you, and you bring up your ID card, you will notice there will be a W number on there as well. However, the pharmacy should also be able to use your student ID if you do not have your Aetna W ID. If they can't, they also can do a name lookup. So
Thank you, Elliot.
hopefully that helps. Yep.
Okay.
Go over the deductibles again. Yes, I'll try this. Again, I highly encourage watch the video online. They do a much better job of it. So basically, the deductible, the first $1,250, if you're using Aetna providers, that is the amount of money that you have to pay out of your pocket before the benefits kick in. So say you go to a doctor and the claim is $100, they bill $100. The student insurance plan would normally cover $80 of that, but that 80 you have to pay that $80 until you reach 1,250. So the first 1,250, probably the easiest way to remember it is the first $1,250 is the money that you pay out of your pocket before the school insurance, before the student health insurance plan begins to pay the providers for the services. Did
Awesome.
that make, I was going to say, um, Gretchen, again, if that's confusing, feel free to reach out to me, get my information from Bailey, and we can have a conversation and I'll try to explain it. But really, that's kind of how that's, it's just the first 1,250 is out of your pocket before the plan begins to pay. So, okay. All right. For dental, need a crown covered by the 80% thing. Unfortunately, no, crowns would not be covered. The dental plan is preventive only, cleanings, some x-rays, regular office visits and things like that. Bailey, through Gallagher, do they have a buy-up dental option? I can't remember if they did or not. We can ask Lindsay.
Yeah, I'm not sure.
Okay. All right. Jay, could you send your information to Bailey so that she has it so we can follow up on that and get back to you? And to answer your question, if you graduate in May, you are covered until the last day of July when the plan ends. You're covered till the end of the semester. So you would,
Actually,
oh, for
I'll have
GAs,
to
that's
correct
right. I'm
that. I'm
sorry.
so
I'm sorry. I'm
sorry.
so used to working with semesters, not monthlies.
That's
Sorry,
okay.
sorry.
Yeah, the GA plan is a monthly plan. So your insurance will begin on the first day of the month that your assistantship begins, and it'll end on the last day of the month that your assistantship ends. So if your GA position goes through May 10th, the day of graduation, you'll have insurance through May 31st. One exception to this is if you weren't graduating and you were continuing as a GA the next fall, you would stay on the health insurance plan through the summer. But if you are graduating and not continuing as a GA, your health insurance will end on the last day of the month. So I hope that clarifies coverage.
Yep, thank
Thank,
you.
thank you, Bailey.
Yep.
Um,
Just
okay.
to add a little bit to that, we do have an option for continued coverage on the health insurance plan. It's up to 3 additional months, but that cost is also to the student. So you can stay active on the GA health insurance plan, but you would be responsible to pay those monthly premiums.
Okay, moving down. Heard hospitals remain at full-time emergency during holidays in the US. That is correct. All emergency rooms, hospitals are open for emergency visits in the US, most definitely. Um, Means no regular checkup and doctor's availability. What I would suggest is it depends. Again, hospitals and the ERs would be open, most definitely. As far as your own doctor and checkups and things like that, it's always worth placing a phone call to see what their holiday hours are. Most of the time, doctors' offices do close in observance of the holidays. In the US, the three biggies that are coming right up are Thanksgiving, Christmas, and New Year's Day. But it's always worth it to put a call into that doctor's office and ask if they are going to be open those days or if they have staff that are seeing people, for any reason. So, but your emergency room would always be open. Okay. Try to get your medical ID card using your ID and date of birth. Says no records. If you could send your information to Bailey, please, she'll forward it to me and I'll find out why you are not able to pull an ID card. They should be there.
Mhm.
So definitely. Um, Respiratory, allergy issues since you've arrived here. I feel your pain. I suffer from allergies pretty much 24/7, 365 days. And let me look real quick at something here. Yes. Okay. Allergy testing and allergy injections are covered under the student insurance plan. So yes, if you do have allergies, you can go onto the Doc Find, this tool over here, and put in allergist, or you can go to the health center. Bailey, does the Boise State Health Center have allergy testing as one of I believe, looking at the fee schedule from Susan, I want to say they do the testing at least.
I think I'm not entirely sure. I know they
Yeah,
offer so many
I
services.
know they do. They do.
So, yeah, and they're so helpful. So feel free to reach out to them directly, and I'm sure they'll get back to you right away.
Yep. And if they do not, then you can certainly reach out. Again, use the DocFind tool, put in allergist or allergies, and find an allergist, and they will do the testing, and that is covered under the insurance plan, as is the allergy injection if the doctor deems that you need injections to help get them under control. So, if you have any further questions, you can reach out to us. And, like I said, I feel for you. The allergies, I don't know about out on the West Coast, out in Boise, but here in New England, they have been atrocious this year. So I definitely understand what you're saying. So, okay. Doesn't cover weight loss drugs. Is there a buyout option for those drugs? Um, as far as the weight loss drugs, are you referring to, and I'm going to use a terminology that's pretty new in the medical field, are you referring to the GLP, and this is for Resvan, the GLP-1 weight loss, such as Wegovy and things like that? Yeah, okay, thank you. I will double check on your plan. That's becoming something that is some schools are covering it, some are not. So I'll tell you what, if you can give Bailey your email address and contact information, I'll take that as a takeaway and follow up and get an answer back to you. Because that's changing as those things become more and more prevalent on the market. That's changing very, very rapidly. So I want to make sure I give you the most up-to-date answer on that. Because some states require we cover them, some do not, and I just want to double check everything before I give you an answer. So if you can just follow it, that would be great. Thank you. Is massage therapy covered by insurance? This is a great question. We get it all the time. If technically, if you just go out for a massage, no. If massage therapy is something that is it is diagnosed that this will be beneficial and it is medically necessary, it can be covered. What we recommend is your provider submit a predetermination to be reviewed for the medical necessity. If it is approved that massage therapy is the best treatment for the situation you're in, for the issue you are experiencing, and it is approved, then yes, it would be covered and it would be therapy benefit. So, it's one of those that just to go get a massage, no, because if it was, I'd be out there doing it. Trust me. But no, so no. But if you have a condition and your doctor seems to think that massage therapy would be the best treatment for you, they can submit a predetermination. They can call the student health, the 800 number, the service number, and ask for the predetermination line. The intake people at that line will gather all the information and tell the doctor what they need him to submit, him or her, what they need to submit. They'll review it, and if it is approved, then your massage therapy would be covered. But it has to be a medically necessary need for it to be covered. Great questions, you guys.
So I'm not sure if I'm skipping over anyone, but there is a question from Jay, and it has to do with addresses being missing from the Aetna doesn't have the correct address for you. This is actually something to just let the whole group know. Um, at the time of enrollment, when we add you to the plan, often we don't have your address on file yet because you haven't officially started with the university, especially if you're a new student or an international student. Um, And the address we're using is whatever's in our PeopleSoft systems. So if you haven't updated your address, we don't have one on file for you. So if you're getting a message like this that they don't have your address, reach out to me directly, provide your address, your student ID number so that I can get it updated on our end. And Jay, I will do that for you today.
Oh, no, mine was already done. I experienced this
Oh.
last year, and then that's how I changed it. So I just wanted to help with that question.
Awesome. Thank you for that.
Thank you. So, the University Health Services on campus, Gretchen is saying that she believes they have covered massage for GAs. I can get back to Bailey on that. I'll double check that. I just got the list of all the things that they do. Susan, who's my contact at the health center. So I'll look at that and let Bailey know, and she can let everybody know if that is a service that's done over there. Thank you for that information.
I did the massage therapy too. It is a service that's available. You just need to call in and let them know you need it, and then they'll schedule you.
Cool. Thank you. Yeah, the University Health Services, they perform, you guys have a very, 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 very inclusive health center with a lot of services offered. I'm not privy to everything that they are offered. I'm definitely more focused on the Aetna student health plan and what can be done and covered through Aetna. So if you are questioning, what is covered, I definitely would reach out to them. And I believe they have a pretty informative web page as well, for what they cover. So it's worth checking them out as well because they do offer quite a bit. And usually going to the student health services, there's usually like a student health fee that everybody pays. And then once you go to the student health services, it's either a very low cost or no cost type of thing for getting services over there. That's how most student health centers operate. So I definitely would check them out first and maybe make them your first contact if it's something you're just looking to have done and it's not an urgent care or emergency room type of situation. That is correct. There's no deductible at the health center. The deductible is waived. That is correct. That's another benefit for going there.
Do we have any other questions?
Excuse me.
Before we wrap up, I just wanted to share the GA Google site with you all again. You'll need to be using your employee credentials in order to access this. But there is a tab up top for health insurance, and it has some helpful information on there and links and requesting proof of coverage at the end of your coverage period, things like that. We'll also post a video of this recording to that website as well. So again, just make sure you're using your employee email address to access that site. Okay, and if there's nothing else, I think we will go ahead and wrap up.
Okay.
Thank you, everyone.
Yeah. And again, if
Thank
something
you,
comes
Elliot.
up and you have any questions, by all means, just reach out to Bailey. She'll give you my information and we can, I can gladly respond to you on an individual basis. So, all right. Thank you all. Have a great afternoon.